Hi, my name is Aiden Burns. Today is October 27th and I'm going to complete my head to toe video. So first I'm going to come in and I'm going to do proper hand hygiene. Okay. So hi, I'll be your nurse today. My name is Ava. I just have a few questions getting started. So can I have your name and date of birth, please?
Sierra Smith, 2006, September 16.
And your age and occupation?
I'm 19 and a student.
Okay, and your sex of birth?
Female.
Female, and gender?
Female.
And what brings you in today, Sierra?
Just a general checkup.
Okay, wonderful. So, are you currently taking any medications?
No.
Do you have any illnesses or allergies?
No.
Do you have a significant past medical history? And do you smoke, vape, or use alcohol? Okay, and are you exposed to any environmental or occupational hazards? Have you traveled recently? Can you tell me where we are right now?
LRC.
Okay, and that's everything I have to ask for you right now. So I'm going to move on to vitals. I'm going to start by taking your oxygen level. So put that on your finger there, thank you. And while I'm doing that, I will take your temperature. Wonderful. So I'm just going to pull back the pinna and take your tympanic temperature. Okay. You're ringing at a 37.3, which is maybe a degree on the warm side, 0.1 degree on the warm side, but it's in the expected finding between 36 degrees Celsius to 37.2. Okay, and your oxygen level is 99%, which is in the expected finding for a healthy adult between 95% to 100%. So next, I'm going to take your pulse. I'm going to check your radial pulse here. Okay, wonderful. So your heart rate is at 84 beats per minute, which is in the expected finding for an adult between 60 to 100 beats per minute. And your respiratory rate is at 16 breaths per minute, which is also in the expected finding for an adult, which is 12 to 20 breaths per minute. So next I'm going to take your blood pressure. And first, is there any arm that you would rather me use, injury or anything? No? Okay. So I'm just going to measure this. This should be 40 to 50%, and the bladder of the cuff should be 80 to 100. Excellent. And have you smoked or exercised in the last 30 minutes?
No.
Okay. And do you know your normal blood pressure?
No.
Okay. Okay. Well, first, I'm just going to check the equality of your radial pulse. Okay, wonderful. And I'm going to grade it at a 2+. All right. I'm gonna go up until I stop feeling your radial pulse. And now I'm going to listen to your brachial pulse. I'm gonna go up to where I stopped hearing it, then plus 30. Okay, so your blood pressure is 115/80, which is close to the expected finding for a healthy adult, which would be 120/80. Okay, so now I'm going to move on to neuro exam. I just have a few questions to ask you. Do you ever have frequent headaches? And have you ever had a head injury before?
No.
Do you ever feel dizzy or lightheaded? Have you ever had a seizure before? Have you ever had shakes or tremors?
No.
Do you ever have any weakness? Do you ever have numbness or tingling sensation? No. Okay. Okay. At this time, I'm just gonna look at my cue card. Okay. Okay. And do you ever have any issues with coordination? Okay. So now to begin my neuro assessment, I'm going to check your cap refill, I'm going to check your muscle strength. So if you can just put your arms up like that for me, thank you. I'm going to pull and you just keep your arms in the position that they're in. Okay, and again, I'm going to go move this way and, okay, so I'm going to grade that at a 5+. And now I'm going to check your lower extremity muscle strength. So I'm just going to push up and you keep your feet in the position they're in. Okay, and vice versa, I'm pushing down. Okay, I'm gonna grade that at a 5+ for muscle strength. And can I get you to swing your legs up for me? Just like so, thank you. Okay, so now I'm going to assess your facial symmetry. So I see that the ends of your eyebrows are symmetric, your palpebral fissures are even, nasolabial folds are symmetric, and can you give me a smile, please? The corners of your mouth are also symmetric. So next I'm going to assess your eyes. I'm going to look at the size of your eyes, your pupils. I see that they're at 4 millimeters dilated. So that's in the expected range between 2 millimeters to 4 millimeters. So next, using Perla, I see that your pupils are equal. They're both round, and I'm going to check their reactiveness to light. So first I'm gonna begin by checking the direct reaction. Okay, you see that one constricts, and over here. Wonderful, and now I'm gonna check the consensual. When I shine the light into this eye, into your left eye, your right eye should be constricting. Okay, and vice versa, the other side. Wonderful. And now I'm going to check the accommodation of your eye. So I'll just get you to look at the top of my pen light here. Okay, I see that you're able to follow my pen light and your pupils constrict. Wonderful. Now I'll just get you to take a drink of water, please. So I see that your trach is midline and it's moving in an up and down motion. Wonderful. And I see that your body positioning is appropriate for the given situation. You're able to answer my questions appropriately and your speech is clear and coherent. So now I'm going to move on to the respiratory system. And I just have a couple questions for you. Do you have a cough or any sputum? Okay, and do you ever have any chest pain? Any shortness of breath? And do you have a history of respiratory infections? No? Okay. So, I'll just get you to lie down for me, please. I'm going to check the shape and configuration of your torso using my pen light. Okay. So I can see the contour of your torso, and I don't see any abnormal masses. I also see that your thorax is symmetric, and your ribs are positioned at a 45-degree angle. Wonderful. So if you don't mind, I'll get you to sit back up for me. And I'm just going to go to your back side here and take a look at your spinal process. So I can see that the spinal process is midline and the scapulae are symmetric as well. And while I'm back here, I might as well auscultate the posterior part of your lungs. So using the diaphragm of the stethoscope, I'm gonna find C7 and auscultate the apex of the lungs, which goes down to T3, and then the base of the lungs at T10. So every time you feel my stethoscope, just take a normal breath in for me, please. Wonderful. So now I'm going to come back over to your front side, and I'm going to auscultate the anterior part of your lungs. Okay, so again, every time you feel my stethoscope, just take a normal breath in for me. I'm going to start by auscultating the apex of the lungs, which is above the mid-clavicle here. And I'll just get you to lift your breasts up for me. Thank you. Okay, wonderful. So now I'm going to auscultate the lateral side of your lungs. So I'll just get you to turn to the side for me, please. Thank you. And just one arm up over the head is fine. So I'm going to find the axillary line, or maxillary line, and auscultate in a zigzag motion. And since this is I'm auscultating the right lung, I'm going to listen for the right middle lobe. Okay, very good. And I'll get you to turn your body around, and I'll auscultate the other side. So arm up over your head, please. This time I'm auscultating the left lung, the side of the left lung. So maxillary line, and I'm auscultating in a zigzag motion again. Wonderful. Thank you very much. So now, moving on, I'm going to move on to the cardiovascular system. And I just have a couple questions for you. Do you have any chest pain? Any shortness of breath? And do you tire easily? Do you ever turn blue or ashen? How many pillows do you use at night? Do your legs or feet ever swell? And do you ever feel the need to urinate frequently during the night? Okay, wonderful. So I'll get you to lay down for me. I'm going to auscultate your heart. and with the diaphragm. I'm gonna start by locating the jugular notch and go down to the angle of Louis, and then to the left side, left intercostal space, I'll be listening for the pulmonary valve. And I can hear that S1 is louder. And again, jugular notch, angle of Louis, second intercostal space to the right. I'm going to be listening to the aortic valve. Okay, excellent. And I can hear that S1 is louder. So now I'm going to go down to the third intercostal space, slightly to the left, and listen to Erb's point. I can hear that S1 and S2 are equal. And now I'm going to go down to the fifth intercostal space to the left and listen to the, fifth intercostal space to the right, and I'm going to listen to the tricuspid valve. If you don't mind just lifting your breasts up for me. Thank you. Okay, and I can hear that S2 is louder. Same on the other side, fifth intercostal space down, I'm going to be listening to the mitral valve. Okay, and if you don't mind, I'm just going to check for your radial pulse here. I'm going to listen for a full minute. Okay, wonderful. So now I'm going to auscultate again, but using the bell of my stethoscope, and I'm going to listen for any heart murmurs or bruit. So, okay, second intercostal space, I'm going to listen to the right side, the aortic valve. Okay, and pulmonary. Erb's point. If you don't mind, I'll get you to lift your breasts up for me. Thank you. And the tricuspid. Okay, and mitral. All right, wonderful. I don't hear any heart murmurs or bruit. So now, while I have you laying down here, I'm going to check for any edema. Okay, and I'm going to check your cap refill, so if you can just squeeze the tips of your fingers there. Okay, and I see that the cap refill is about 2 seconds, which is the expected finding. Also do it on your toes down here too. Okay, wonderful. Expected finding of 2 seconds. And I'm going to check your pulses in the lower extremities of your feet. So first I'm going to begin by checking the dorsalis pedis. Okay, so I can feel that that is a 1+. And now I'm going to check the tibial posterior tibial. Okay. And I'm also going to grade that as a 1+. So moving on from the cardiovascular system, moving on, I'm going to assess the skin. So I'm going to ask you, do you have any rash, any lesions, or excessive bruising? No? Okay. So I can see that your skin is intact. And I'm going to assess the tuber, the elasticity of the skin. Okay, wonderful. And I'm going to check the temperature of the skin using the dorsal part of my hands. Wonderful. Warm, which is the expected finding. And moving on, I'm going to check the abdominal and the abdomen, and I'm going to move to the right side of the bed. So first I'm going to ask you, actually, I'm going to check my cue card one more time. Okay, I see that you don't have an IV, but if you did, I would assess that appropriately. And I would do a Braden scale assessment on you to check for pressure sores, but just for the sake of the video, I'm not going to do that today. And moving on to the abdomen, I'm going to ask you, do you have any abdominal pain? And any nausea or vomiting, constipation or diarrhea? Do you have an increase in appetite? Any unexpected weight loss or weight gain? Okay, and I'm going to auscultate your abdomen. With the diaphragm. Okay, so I'm gonna start in the lower right quadrant and work my way around to the lower left quadrant. Okay, wonderful. So I heard bowel sounds right away, which saves me the time. If I didn't hear any bowel sounds, I would have to wait. I would have to auscultate for a full 5 minutes. So now I'm going to palpate the abdomen, but since my hands are cold, and I'm just going to use yours. Okay. I'm only going to go about 1 centimeter deep while palpating. Okay, and did that cause you any pain?
No.
Wonderful. So, when was your last bowel movement? This morning, okay. And for urinary output, when was your last void? This morning, okay. And how was the color and clarity of that?
Pale yellow and clear.
Clear, okay. And I see that you don't have a Foley, but if you did, I would assess that and empty it as necessary. And if you had a stoma, I would assess that as well and do any needed dressing changes. So now moving on to musculoskeletal, do you have any muscle pain or muscle cramps, stiffness? Okay, and I see that you don't have a mobility aid, but is that correct? You don't have one?
Yeah, I don't.
Okay, wonderful. And I'll get you to stand up for me and do a couple steps just to see your gait. Okay, wonderful. So I see that your gait is strong and steady. Thank you for coming in today, Sierra.